Welcome back. You tuned into Inspired Afternoons with me, Mariam Mia. And now we're talking mental health awareness. And joining me online, I'm so pleased to have a psychiatrist, Firoza Arbee. And Sister Firoza is a specialist psychiatrist with a keen interest in women's mental health and promotion of social awareness and destigmatization of mental illness. The cultural and religious influence on the presentation of mental illness and seeking of treatment has been a motivation for her choice of specialty. Sister Firoza Arbee hails from deep in the rural Mpumalanga, and there she was brought up with a strong sense of community and social responsibility, a very much a family-orientated individual who then completed her postgraduate studies in Johannesburg. She's a mother of three and has been in private practice since 2012. And Sister Firoza is also a consultant psychiatrist at the High Security Forensic Ward at Sterkfontein Psychiatric Hospital. She served as an expert witness for the state in fitness and responsibility hearing. She has a master's in medicine in the field of psychiatry. So a really, really accomplished doctor and psychiatrist, and also her passion is my passion as well, and she's in the field in terms of destigmatizing mental health as well as highlighting mental health, especially amongst females, because really when people are saying, they're feeling depressed, they have a condition, it's put down to, you need to establish your connection with the Almighty, or you need to pray more. And it's always it's always linked to prayer, or you're not praying well, or it's your trial for some reason. But the thing is, mental illness is a very real condition. And that is my argument, or what I put forward, that if it was just down to not praying enough or establishing a link with the Almighty, then why do we have a special branch of medicine that's dedicated? Individuals like Sister Firoza has spent a good part of her adulthood life studying this illness, the manifestation of the illness, the treatment thereof, the support thereof, the auxiliary support thereof. We have auxiliary support like psychologists, counselors, therapists giving you support. So there's this, it's in terms of medicine, you have a DMS for classification in terms of classifying various mental illnesses. So why do we have this if people are just going to put this down, or even our leaders, our leaders in our communities are going to put down mental health to just, pray more, establish yourself. Yes, that is part of treatment, is to pray. Zikr does make you better. Zikr does make you feel more grounded. Praying to Almighty, having conversations with Almighty does change cognitions, calms you down, but it is part of a holistic treatment, just not a be-all in end-all. And I feel it's time now. Yes, I feel passionate about this, and you can hear the passion in my voice, so please do forgive me. But I think now it's important that our leaders in our community acknowledge this and guide people towards treatment, and also be part of that support group, because it takes a whole community support structure from your family, external support, community support to assist somebody as they tackle mental illness challenge. Yes, it's not like when you get cut, you put the Band-Aid in after 2 weeks. Alhamdulillah. So let me welcome Sister Dr. Firoza Arbee. Assalamu alaikum, and shukran for joining us here on Inspired Afternoons on Salam Media.
Wa alaikum salam, Sister Mariam. Jazakallah for having me.
So tell me, does it make sense to you what I say in your field when patients do come to you? Are these some of the societal challenges that patients face regarding mental health issues?
Definitely. I think I come from a generation, or rather, should I say, my parents and the culture that I grew up in does not have words for mental illness. You and I are lucky. We have words to use. We can say that people are anxious or stressed, or they have panic attacks. But the childhood I had, those were not words we could use. So when you think about someone in your family that perhaps had a lot of anxiety or very stressed out or a very sensitive nervous system, they would be known as people who always manifested it as different symptoms, and these are physical symptoms. So you'd always hear that auntie or that uncle who was always sick at the doctor, and the doctor didn't know what was wrong with them. They always had headaches, they had body pains, they always had issues here and there, but vague things. And when they go to the doctor would say, I checked you out, there's nothing going on, or there's nothing I can treat, here's some painkillers, or here's some sleeping medication for you. And you know, when there are no words for it, I think I'm, in that sense, I'm a lot like you. We have words. So I decided, let me use that. I don't want to just be the ears for people in my community who don't know how to express themselves. I want to be able to make sense of it for them. And I want to be able to express it in words for them. So Alhamdulillah, I feel like this was a career that was chosen for me. It was my calling. It's my passion. And I really thoroughly enjoy it. I do think there's a big need for it as well in our community. What you're saying makes 100% sense. Nowadays, there are therapists, there are counselors, but back in the day, you went to see your GP and they just wrote you a script and said, see if this makes you feel better and come back. And often our women particularly didn't feel heard, didn't feel like people understood them. Always it was chalked down to you've got a lot of stress, or you've got aches and pains, here's some painkillers, or you've got arthritis, or you've got some other physical condition, but no one was actually listening or saying, could it be this? Could it be that? Men, somehow it's a little bit easier. They become stressed out, they become irritable or aggressive. I mean, who doesn't have that situation where when the father comes home and he's in a bad mood, women will always say, don't trouble your father, he's had a long day. What happens to the mother? Whoever turns to someone and says to someone, your mother's had a long day, please don't nag her or stress her out right now. But somehow it's always been excusable in our society, our culture, for men to have issues. We just called it different names. Women, we became physical about it, or somatics, we call it somatic symptoms, and they'd always have headaches and fatigue and tiredness. I like what you said about, from a cultural point of view, there's a lot of stigma. For me, one of the biggest things, the challenges I face, is that people come to me and say, but why? Surely everyone tells me just make sabr. And that is something else as a woman you've heard. When there are things going wrong in your life, people will say to you, just make sabr, it's in Allah's will. Just make sabr, it's in Allah's will. Correct, it's in Allah's will, but Allah also gave you free will. He gave you power. Empower yourself. There's no need to sit back and find yourself as a victim of external situations.
Jazakallah for that. I say I've got a good friend of mine, an accomplished writer and poet as well, and somebody who feels very strongly and has been campaigning about the issue of mental health awareness. It's accomplished author, Sister Rashida Khan, with us as well, joining us. Assalamu alaikum wa rahmatullahi wa barakatuh, and welcome to Inspired Afternoons here on Salam Media, Sister Rashid.
Wa alaikum assalam, Mariam. We actually friends as well, Phoebe and I. So we're
So there's a connection here.
Yeah, there's definite connection. So we've both submitted short stories or personal anthologies to the Saffron Collection, and that's how we've known each other for about 2 years or longer.
Okay, Alhamdulillah, this is fantastic. Sister Rashida, I brought you in because I know you feel very strongly about this. It's one of the themes in your book that continues from Marakrat to Fragrance of Forgiveness, and something that you use your writing to highlight. I remember an incident, I don't know how long in terms of time ago, and we had it was weekly talim, and they were speaking about depression. I don't know how the topic got there, but depression was spoken to about, and few of the sisters said, yes, well, you know what, depression is actually, you need to then revisit your connection with the Almighty, because that is what depression was put down to, and that's most people put it down. I think maybe it's our limited understanding of what constitutes depression and what the body goes to, and the definite chemical imbalance when somebody experiences depression. And I think it's a lack of knowledge that some people then tell you need to visit this. And I know that statement and that discussion got Sister Rashi hot under the collar and fuming, and she was...
I was very respectful, Mariam.
I know she was... No. She was very polite at that time. She didn't say anything. Being the individual she is, very respectful of the occasion. But thereafter, I know then she contacted me, and then And then we spoke at length about this in terms of just negating depression to just not having a sufficient link with the Almighty. So, Sister Firoza, how do you respond to this? To patients actually come and tell you this, that when they finally come to you. And I know that the other thing is a stigma of visiting somebody like yourself. Because if I have to mention, yeah, because I wouldn't want to tell anybody. I'd be happy if I went to I don't know, ENT and sorting this out, or saying I'm going to gynae or whatever. Ophthalmologist is okay, improving my eyesight. But if I say I came to visit Sister Firoza Arbee, and then if people say, "Oh, isn't she the psychiatrist?" Whoa, alarm bells. You have to worry about this person here because you're not mentally stable. You might be mad, and then I mean, just getting yourself with so much stigma in the society to say that be brave enough to announce, I visited a psychiatrist. Do you have this,
Of
Sister
course.
Firoza?
Of course, I regard myself as one of those grudge visits. You know, people come and see you when there's no other resort. They've tried everything else. They went to go and see that Hakim in Azadville, and they went to visit that Molana in Benoni, and they've been calling their friends about the same story over and over. They got themselves, there's so many things. I'm the grudge visit. And I get a lot of people who come and see me almost resentfully. So they walk in with a chip on the shoulder to say, I'm forced to come and see you because my GP said I must, or the therapist or my friend said she's tired of listening to me now, and I'm actually here, but I don't think you can help me. And that's actually how they start. They come in almost, so I start off some of my consultations on the defensive. Like, I already know what you think of me when you walk in. You have zero faith that I'm going to assist you. And it's initially it was a bit difficult for me not to take that personally. I almost felt like saying, listen, I don't need a patient like you, but I do. I actually want to be that voice for that patient. But I almost want to say, if you don't want to be here, there's the door. I have plenty of other people waiting to see me. But it took me a while to not take that personally and realize it was more what it represented to that person to come and see someone like me. And I promise you, I approach it from a very, obviously, I'm a doctor first. So when you look at the scientific background to what I do, when I give you a scientific explanation of why you are where you are and how it's leading to where you're at right now and what is that manifesting like in terms of your symptoms, it gives the patient immense relief to know that actually there's a reason I'm like this. There's a reason I have no motivation left. There's a reason I sit in my musalla and I can't summon up that feeling of connection that I had. There's a reason why even making huzu or going to sit on my musalla sometimes feel like a drag, that my life feels, and in South Africa, we've got the perfect term for it. You have no bliss. You don't feel like it. There's no joy left. So when people say, make sabr, pray more, it's easy to say, but when you're not in the mood for it, or you don't have the capacity for it, it's an extremely difficult thing to do. And that's where medication can bridge the gap. It can push you enough in the right direction to start giving you that willpower again. So every person coming there, I don't sit there and say, no, don't make sabr or don't read salah. By all means, the spiritual aspect is a very important one. But by the time you're coming to see me, I know that has failed. It's a very easy thing to tell someone, make sabr, read your salah. But when you're in that deep, dark hole where that is not even something you feel like doing, or it feels like a chore, or every little thing exhausts you, just living in your own skin, being a mom, being a wife, being a daughter, that all feels like it's exhausting you and draining you. To tell someone to do something extra, like wake up for tahajjud, maybe the hardest thing they can do, and they've tried. I can promise you, most people sitting in my office don't come there because they've done nothing. They've tried everything. So they're quite desperate. There is definitely a biological explanation for where people are at. I'm not saying every single person with problems or with stress needs to see a psychiatrist. I'm certainly not saying every single person needs to be on medication. I'm saying there's a role for it. When you're diagnosed with hypertension, your doctor doesn't start with, let's give you schedule 6 medication, or let's put you on the highest medication and look at your heart. They'll say to you, cut down the salt in your diet. Live a better lifestyle. How are you managing your stress? Are you exercising? Are you eating healthy? So they start with the smaller, more manageable things. And it's only when those things fail that your GP will say, right, now let's start with the first line medication. When that fails, I'll give you the second line and the third line, and so on and so on. So it's exactly like that. When someone comes to see me, I know all those other steps have failed. They've tried the lifestyle stuff. They've tried going out. They've tried talking to this one. They've tried, cutting away or trying to let their stress get to them less. And it's not working. So by the time you come and see a psychiatrist, I can tell you at this point, effect on your neurotransmitters, on your biology is there. We simply don't have the test in South Africa to test, but if I test your adrenaline levels, we probably would be sitting with dysfunctional adrenergic responses. We would probably be sitting with a deficit of serotonin. So the biological findings are there. We just simply don't test for them in South Africa. It's also quite an invasive test. I also don't want to test blood results. I want to test, or I want to rather treat a human being, not a blood test. I don't want to treat blood levels. I want to treat someone's pain, someone's inability to express themselves, someone's inability to cope for themselves at that point in time. So when people come to me and say, I'm here to see you, I always ask them, or they make it sound like it's a grudge thing. I'll always ask them, would you make sabr if you were diagnosed with hypertension? Do you expect your hypertension to improve? Would, if you had something chemically that I could show you was chemically wrong, like blood pressure is an easy thing because you can put on a cuff and you can see that the blood pressure is high. Would you tell that person, wake up for tahajjud, your blood pressure will go away? Yeah. So we don't do it for patients like that. Why are we saying it to people who are struggling, who have a generalized anxiety, or they're depressed, or who are experiencing panic attacks or severe insomnia? We will try everything else first, but by the time you're seeing a psychiatrist, there's also a space for what I can provide in that hierarchy of treatment.
Absolutely. Sister Rashida, now that you are a strong advocate in terms of mental health awareness, and basically mental health awareness is saying we're trying to help people to become emotionally well-being. So you're changing, you want to assist in a journey to change a person's state to be holistically well. So since you've been raising this, do you think people are now more accepting, more understanding, there's more support? How has this advocacy been received?
Look, I definitely think that awareness is increasing. There's no doubt about that. You know, apart from these kinds of discussions, and there's lots of these kinds of discussions on the radio and even on Islamic radio stations. I mean, I think I heard the other day on one of the other channels where somebody actually, one of the DJs actually, I don't know if you call them a host, I suppose, the show host, actually took someone to task to say, don't minimize mental health stories. Don't minimize these challenges. Don't say it's because you're not trusting Allah enough. And you know, I actually feel very strongly about that, because my relationship or your relationship with Allah is your personal one. The rest of us are not here to judge you, and we can't say, oh, if you're having these problems, then it's because you don't have a connection with Allah, or you're not trusting Allah enough, or you're not, you know. And the challenge is always that kind of attitude towards a person who is already in a vulnerable situation. You know, you end up shaming that person, and I think that's even worse, you know, than anything else that you could do, because that person needs to be in a position or in a place to be able to talk about what's happening in her or his life. And you know, we underestimate the effects and the impacts of trauma, but even on just daily life. You know, nowadays our worlds are so challenging. Apart from just the COVID story and the stress we have with the lockdown and the not being able to engage and interact normally with people. Apart from all of that, you know, the social media is something. The phones keep us so busy, and we're always wanting to know what are we presenting out there and how people are perceiving us. And those kinds of pressures really, really add up. And you know, it's not to say it's easy to say to people, switch your phone off, but it's not so easy to actually accomplish. So we have to be able to introduce, whether it's techniques or things that work for us, to be able to cope better with these things. And you know, it actually is, there's quite a bit available online. There's quite a bit of information, and I'm not saying go online, because obviously sometimes you get a whole lot of different things, but there is information out there, and people are becoming more aware. And if we just destigmatize this in a sense that, I mean, just as Firoza said now, you know, if you have a headache, you take a Panado. You know, that's the least thing we do. So everything, there is some kind of
Treatment. Yeah.
resolution or some kind.
Mhm.
We need to be able to be free to address these, and statistics are really scary. They say 1 in 3 or 4 people will suffer some mental health challenge in their life at any point. And in fact, if I tell you, those figures are higher amongst young people, amongst teenagers and young adults. Those statistics are even higher. So our children are not coping well. And if we are not giving them the platform or the safety to say that I'm having this problem, whatever it is, I'm not sleeping, or I'm having anxiety, or I'm having panic attacks, or whatever it is, if we're not able to let our children speak to us openly and freely about that, then we have to be able to create that space for them, because we want them to turn to us. And obviously, we're not going to say you only going to go to the doctor, or we're going to get you on antidepressants. We're going to make dua for our children. We're going to ask them to also trust Allah and make dua for themselves, while at the same time addressing these things. And the other statistic is that intervention.
Sister Rashida, I'm almost caught up with time. I just want to get back to Sister
Yes.
Firoza. Sister Firoza, in terms of expert support and advice, firstly, if you can just tell us, as a patient, if you are feeling that you would, like you say, I want to use this Afrikaans word because in English there's no comparison. So if you don't, you just lost that lust for life. You are a really affable person, a people's person, and suddenly you find yourself, you don't want to even get up in the morning, get dressed, your hygiene routine goes there. Even in terms of how you're looking, you don't even feel like putting moisturizer on your face. And if you feel that slump, you suddenly feel that you're obsessing about everything, you're gravitating towards some sort of obsessive compulsive disorder. Do you encourage, do we take the step first to speak to our GPs and then get psychiatric help? And then also, we as support base to our family, our friends, and that, what is advice to us in terms of supporting somebody to have a mental health wellness, in terms of contacting a psychiatrist to go and have yourself properly diagnosed?
Okay, so the first thing I always believe, a healthy woman is a healthy family. We are the pillar of our homes. If you're not okay, everybody suffers. From your husband to your children, to the home, to the extended family. A healthy woman is a healthy family. Let's understand that. So to fill this cup is to feed your family. So stop looking at me time or prioritizing yourself as a selfish thing. Self-care is a form of ibadat. I think it's such a thing. I cannot stress this enough for women. If you're not feeling okay, obviously you're going to start with your immediate support structure, which is your sister, your mom, your friends. Start chatting to them. But if you're finding you not getting to a place where you're able to move past it, so then go and see your GP, or even engage with a therapist. It can be a counsel in the community. This can be someone at Islamic Care Line. This one can be someone part of your Talim group that is a spiritual advisor for you, perhaps a counselor, psychologist. So it doesn't need to be, let's head for the big guns and let me get me some Schedule 6 script. It starts somewhere. If the feeling persists for longer than it should, longer than normal, then by all means go and speak to your GP and say, look, I've tried XYZ, it's not working out. What do you suggest next? Your GP may have a card or two up his sleeve or her sleeve where they can say, try this, try this. Failing that, they would then make a referral to a psychiatrist. So no, psychiatrist is not your first port of call, but definitely prioritizing yourself should be number one on your list. It's the biggest form of ibadat. Allah gave you this one constant from the time you open your eyes to the time you pass. This is the only guarantee He's given you, is this body. Take care of it. And it's not, it's everything. It's the thing that determines the health in your family.
Jazakallah for that. Time is caught us. I just heard, Sister Firoza, I would like to take up this discussion to then further, inshallah, in coming weeks to discuss specific mental health issues such as depression, obsessive compulsive disorder, post-traumatic stress, especially now with COVID day and the increase, as well as anxiety. So inshallah, please, if you can avail yourself further to talk about specifics in terms of symptoms, what to look for, possible treatments and support as well. And then also, this is an important issue from Brother Muhammad Hassam, who says, what's the take on emotional abuse, mental health issues with respect to parental alienation, separation and divorce matters, child versus money, ransom. So this is important issues in terms of the catalyst for mental health issues, especially when it comes to, in terms of, like you say, parental alienation, separation, which could then lead to mental health issues. So Jazakallah, I am going to definitely get our producer to contact you and further, if you would please inform and educate our listeners. And I'd like to thank you, Sister Rashida, for coming on here and giving us your time on short notice as well. And may you continue be an advocate for use your platform as an accomplished author and writer to carry on highlighting and advocate mental health awareness, in especially in closed communities, to remove that stigma surrounding it, and also be the support for the person going through this, instead of saying, this person just complaining all the time. No, they're not complaining. Their complaining is a plea for help. They are asking you to help them, show them a direction to come to a state of emotional well-being. So jazakallah to both of you, and shukran, we appreciate your time here on Inspired Afternoons on Salam Media. Assalamu alaikum wa rahmatullahi wa barakatuh.
Jazakallah. Thanks,
Walaikum
Mariam.
salam.
Salam.
And that's the show for today. Jazakallah for giving me or honoring me with the privilege of your time. And inshallah, we make dua that you have been educated and inspired and enlightened on the show. And until next week, may you be under the mercy and the protection of the Almighty. Assalamu alaikum wa rahmatullahi wa barakatuh.